Mendelian conditions are rare and often quite severe, but complex traits like high cholesterol, type 2 diabetes, rheumatoid arthritis, depression, coronary heart disease, and obesity are more common in the population. Many families seem to have a high incidence of one of these traits, indicating that they have one or more risk variants for that condition. Each complex trait has a different amount of heritability, which tells us how much of the variation observed in that trait can be accounted for by genetics. Genome-wide association studies can provide further insight into the genetic basis of a disease by allowing identification of disease-associated variants and calculation of an odds ratio, which provides an estimate of how much a variant increases or decreases risk of a condition. However, most traits still have a substantial amount of missing heritability, meaning that we don't yet understand all of the genetic risk factors. In addition, while heritability and odds ratios are predictive at the population level, many questions remain about how to use this information to predict risk in an individual. Predicting the risks associated with genetic diseases requires an understanding of conditional risk. Every trait has a general population risk. For example, nearly 10% of all Americans have type 2 diabetes. However, the risk that an individual will develop diabetes within the next decade may be considerably different than the general population risk, based on factors like age, weight, ethnicity, physical activity, diet, and family history. To determine the risk of an individual based on one or more of these factors, you can look at the risk of a subset of the population with that same characteristic or set of characteristics, and adjust the risk prediction of the individual accordingly. Let's look at an example of how this works in more detail. Let's look at the risk of coronary heart disease, or CHD, which is the buildup of plaque in the arteries of the heart, and which substantially increases risk of heart attack and stroke. CHD is a complex trait determined by genetics and the environment. The risk of an American adult developing complications of CHD, such as heart attack or stroke, is about 6% over a 10-year period. However, if we look at these two individuals, Adriana and Joseph, you might imagine that their risk is quite different. How can we use information about both their genetics and environment to give them a more accurate picture of their risk? To determine the risk of having a CHD-related complication in the next 10 years, we can take their sex and age into account. Adriana is 31 and female, and this lowers her risk compared to the general population. Taking only his age and sex into account, Joseph, who is 47 and male, also has a slight decrease in his risk. Now let's consider how traditional risk factors might impact their individual risks. Cholesterol levels, particularly high levels of LDL, or bad cholesterol, and low levels of HDL, or good cholesterol, increase their risk. Adding on high blood pressure, smoking, and the onset of diabetes increases risk further. Though you'll notice that there is a differential effect on each of their risks based on their age and sex. Now let's compare an estimate of risk based on traditional risk factors to an estimate based on genetic variants associated with CHD. There are, of course, Mendelian variants that can lead to drastically increased risk. For example, certain rare variants that impact cholesterol levels lead to early onset CHD and increase risk of fatal heart attack 50 to 100-fold if left untreated. However, most cases of increased genetic risk are due to a number of small effective variants. We don't know all of the variants associated with CHD, but a risk score can be estimated by combining the effects of the variants that are currently known. In extreme cases, where an individual has the version of each of these variants that increases risk, the maximum risk is estimated to be about 4 times the baseline risk. This might seem like a large number, especially when presented in percent form as 400% of baseline risk, or a 300% increase over baseline risk. But it's important to remember that in a healthy individual, the baseline risk is relatively low, and the increase in risk is less than the increase that can be attributed to traditional risk factors. In addition, few people carry all of the risk alleles. More commonly, these variants might increase risk 2-fold or less. twofold might still sound like a large increase, but looking at the absolute rather than the relative risk can provide a more intuitive understanding of the odds of developing a particular condition. If you consider the baseline risk of individuals of similar age, sex, and ethnicity, which is 4%, or 4 out of every 100 people, and convert this twofold increase in relative risk to an absolute risk, you can see that in the subset of these individuals who have a similar genetic makeup, 8%, or 8 out of every 100, will experience complications from CHD over the course of 10 years, while the other 92 will not. While this is an increase from the baseline risk, the odds are still low for any individual. It's also important to keep the relative magnitude of these effects in mind, because although an individual's genetics cannot be changed, lifestyle and medical intervention can often alleviate risk from traditional risk factors, which can play a much larger role in determining risk. Thinking about the probabilities in this way will give you a more accurate picture of risk.
At present, many questions remain about the variants that underlie complex diseases. What can account for the missing heritability? How can we combine the risks of different variants in a way that's informative? What's the interplay between the genetic and environmental risks? As we continue to learn more about the underlying genetic and environmental causes of complex diseases, we'll be able to use this information to make better predictions about the risk of an individual. Ultimately, risk is predictive on a population level, but refining our predictions by categorizing individuals into more and more specific subpopulations by physiological, genetic, and environmental characteristics could allow for personalized risk assessment and more targeted treatment of complex diseases.